Welcome to ROI's Couch Conversations. I am your host, Shelly Ann Jackson. Hi, Jeff. Thank you for joining me. I am excited to continue these chats about revenue cycle management, and I'm eager to learn more about charge capture and billing from today's conversation. What are some of the biggest challenges you have noticed as it relates to charge capture and billing?
Yeah, so in the area of charge capture and how that relates to billing, charge capture has long been a struggle in hospital organizations. I recall back when I was a CIO here in Fort Smith, Arkansas, we had an issue, or it wasn't really an issue. We thought we were killing it on a procedure. This was back when drug-eluting stents first came out. We were doing all these drug-eluting stents and really doing well until we realized a month or so later that we were not charging for drug-eluting stents. We were charging for just regular stents, and we're actually losing about $500 per case. So, although we were doing a lot of volume, we were actually losing money. So that's an area where not having your charge description master updated in a timely manner, not monitoring that, making sure that the things that are flowing through your electronic health record, or things that are flowing through your system, are creating the proper charges on the billing side of healthcare. Had a conversation with someone once about the importance of correct billing, and this was a nurse friend of mine, and he said, people go to the hospital to get a bill. And I said, no, that's not why they go to the hospital. But if when they get done, their bill is screwed up, that's the last thing they remember. So it's very important for an organization to make sure they are capturing all of their charges. And some CFOs out there may be thinking, well, although we bill, we're getting paid on DRG, so why is it so important to capture all of our charges? It is. And as we look at the future of healthcare, it probably becomes even more important. If you're not capturing all of your charges, all of the things you're doing for that patient, you're never going to understand the true cost of that care. And you're not going to be able to do more in a value-based care plan or bundled payment scenario. As you're looking at how you're going to bundle those payments, you truly need to understand your cost of care. Also, everything you capture from a charge perspective, at the end of the year when you're looking at your cost reports and things like that, that could improve your reimbursement from Medicare, especially if you're a disproportionate share hospital. The other side of that is making sure that everything that's done to and for that patient shows up in that medical record and shows up, on that bill. It also then becomes a patient safety issue, right? So you know exactly what you did to and for that patient. And as we look at the future and the continuum of care, that information gets moved on to the next visit and the next visit. So, that's where I see revenue cycle having a significant impact on the entire continuum and the entire, patient experience. As we look at examples of how we do a better job of charge capture, as simple a thing as a CDI program, a clinical documentation improvement program, is paramount in making sure that everything that is being provided to that patient by your physicians, by your clinicians, is documented and is accounted for as we look at the billing process. That's key. That's very important. Making sure that your charge description master is up to date, as we mentioned a moment ago, and also making sure that all of those charges, whether you're going to be reimbursed for them or not, are making it through the interfaces and making it onto a billing system so you are able to keep track of them and so that they show up in that patient's record going forward. And then obviously the financial benefits, the better job you do of keeping track of everything you're doing to and for that patient, that's going to impact your bill for those payers that are paying a percentage of charges or paying, some sort of fee for service type of thing. Doing a better job of capturing all of those charges for those patients that have insurance that pays still a percentage of charges or a fee for service type of schedule, that's going to be key. That's going to improve your reimbursement. Also, capturing all of these things, capturing all of your charges, all the things you're doing for those patients from a clinical event perspective could also drive your case mix index up, which is going to improve your reimbursement overall. It could also increase the severity of illness as you're looking at your DRGs, may have a higher DRG or even a higher multiplier on that DRG. And as we look at the outpatient setting and look at, hierarchical condition codes, things like that, I mean, the better job you do of capturing what you're doing to and for that patient, the better and higher reimbursement opportunity you have there.
Jeff, thank you so much for spending time with us. Stay tuned for the next episode where we will discuss receivables management.